to see each case. Each case is different. Each person's different. Each indication is different. That's why we like to spend time with each person and analyze the person, listen to the person, review the records, review the physical exam, and then, and only then, make recommendations. Again, my name is Dr. Lederman. We're going to stop to hear some voices about our work, and we'll be right back. Thank you.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We're back talking about patients, news, being healthier, avoiding complications. We had a woman who came in this past week. She's from Brazil. She's a missionary. She's very fair-complected, blue-eyed. And, yes, guess what? She has a skin cancer. Skin cancers affect people who are more fair-complected. She had a squamous cancer of the left lower eyelid in the area by the nose. She was treated elsewhere with Mohs, M-O-H-S, Mohs surgery. Mohs surgery is advertised as 99% successful, but we certainly see lots of patients with recurrent cancer. I talked about this gentleman a few minutes ago with the cancer on top of the head, was left with a big deformity. It still hasn't healed more than a year later. This woman 6 months ago had Mohs surgery, which is a way of slicing. If you think about slicing a salami, slice, try to take out all the cancer cells, and then do something, either sew up or heal or transplant tissues to fill up that hole. Many skin cancers, unfortunately, occur in the face area because there's a lot of sun exposure in the face. So there's a lot of cancers by the eyes, the nose, the mouth, the ears. Well, this woman has a cancer on the eyelid. She had Mohs surgery. She has no insurance, so she comes from Brazil. She finds a way to pay her care. She paid for Mohs, and 6 months later, the cancer is back. So it's pretty sad news for her and her husband and her family. She was told by her surgeon, well, they didn't get it last time, so they're going to try to do it the same thing this time. Well, this time she's a lot more reluctant, and actually one of our patients who has prostate cancer suggested she come in and see us about treatment, and I've seen her. She got staged up. We wanted to make sure the cancer hadn't traveled anywhere from the eyelid deeper into the head or brain area, and it had not. So we talked to her about radiation, and we have a large experience treating cancers, even of the eye, eyelid, nose, mouth, ears, because those structures are so hard to reproduce. When they cut out areas, it's very hard to get normal function, and abnormal function around the eyes, nose, ears, and mouth is obviously devastating. She was told by her surgeon that she may even lose her eye from this cancer. This is a 50-year-old woman, beautiful woman with a husband and kids and a life, and she's a missionary, and she's kind and generous. And she came to us to try to be cured, which is what we're going to do to try to help her without the deformity of further surgery in the eyelid. So we got the staging. The cancer hasn't traveled. It did come back after Mohs, and our success rate is vast. We're not perfect, but it is vast, and we hope that we can put her into remission once and for all. Another gentleman in the good news department, he came with a sarcoma of the thigh. So again, I talked about sarcomas earlier in the hour being a rare tumor, but we see many people with difficult cancers. And this man had a large cancer of his inner thigh. He had surgery. He was sent to us by his surgeon, and we gave radiation. Why? Because it seemed that the margins where the cancer was and where the surgeon cut were intersecting. So we got him checked out. We did scans and proceeded with radiosurgery, focused beam treatment to his leg, and in fact came in now, follow-up, doing well. MRIs, contrast studies show good resolution of the cancer. So he's doing great, feeling great, and carrying on a normal life, which is our goal. Another gentleman we saw, another skin cancer. Can you believe it? Normally you think about summertime being skin cancer time. Well, you can get skin cancers any time of the year. Summer, winter, autumn, fall, any time of the year. This man is an accountant, had melanoma, which is one of the most feared cancers of the skin. Melanomas can spread. And this man, he had the cancer cut off. And a couple years later, he was going for another surgery, I think arthroscopic surgery on his knee. They did a chest x-ray just routinely. And voila, the cancer came back. A big mass in the chest. And he started at a big cancer place. 6 years of chemotherapy. Can you imagine? 6 years of chemotherapy for one mass in the body. It was inoperable. They never talked about other options. In fact, they never even told him about the results of the scan other than everything's okay. And finally, this year, he got a hold of his results. Now, we give our patients the results whenever we see the patient. This other place, he never got results. Finally, when he got his hands on the results, he saw the cancer used to be little tiny cancer, was now 13 centimeters, about the size of two man's fists, in his chest, wrapped around the mediastinum, the delicate structures in the center of the chest. He was upset. He wants to live. He wants to live a normal life. He's referred by a prominent physician in New York who knows our work and seen our work and likes our work. And after the informed consent process, we treated this gentleman with focused beam radiation for melanoma, metastatic to the chest. It's his only site of disease, wrapped on all the critical structures. He had his 5 treatments, each treatment about 15 minutes, non-invasive, well-tolerated, outpatient, just as promised. He's done well. He came for follow-up, and now we're going to get him staged up to evaluate the response to therapy. We'll tell him first, then his doctor, and then you, so you can learn about other treatments that he never imagined could work in him, and he still can't believe it will work. But according to our data, and we've treated about 20,000 patients, most likely it will work, and most likely it will put him in remission for the first time in years. Of course we wish him well. And another man who came to us last year, at the time he had a high Gleason 8. Gleason is how the cancer looks under the microscope, PSA 10. I told him he had a risky cancer. He's a black man. The death rate from prostate cancer is double in the black community as elsewhere. He, unfortunately, but everyone gets to choose their own course. Each person is the president of the United States of their body. He chose to double down on vitamins, antioxidants, diet. So what happened doubling down on vitamins, antioxidants? His PSA doubled. It went from 10 to 20. He was in deep trouble. He came to us, we treated him, and he's now in remission, doing well, fully functional. This is Dr. Lederman. We're going to say bye-bye for now. If you have questions during the week, please call us at 212-CHOICES, 212-246-4237. We look forward to our next show tomorrow morning at 6 a.m. Thank you, good night, and have a wonderful weekend.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas expressed.